So today our program is the importance of sleep for seniors. This is our eye care program today, and I have to tell you, I'm probably the prime candidate to be teaching this today because I don't know of anybody that has more trouble sleeping than I do, and I'm going to share some of that with you today because I've learned so much by doing this program and meeting with people who deal with this issue. What I do want to tell you is there's some things that we are not going to talk about. And I know that I go to these programs and people get into these long orations about REM sleep, non-REM sleep, the effects of norepinephrine in the brain, and they talk about serotonin uptake. So today I want you to know we're going to be down and dirty. We're going to talk just real, what are the issues of sleep? We're not getting into the neuropathology of this, and certainly I'm not prepared to teach that. If any of you are interested in that, put that on your survey and we'll get someone to come in and talk about that. But today, common sense, real help for all of us, the everyday person that might have some trouble sleeping. We know that at any age, people can suffer from sleep problems. But what I want to focus on is the caregiver and the care recipient. Because the caregiver needs as much sleep to be able to do their job as the care recipient does to have health. If the caregiver is being kept awake because the care recipient can't sleep, I have to tell you this is where we get into a lot of tension. The caregiver not getting enough sleep has problems with their immune system. They tend to get sicker more. They suffer more depression. We'll go over all of that, but just to get an idea of who are we focusing on today. So it's you, the caregiver, for that person that you're caring for. And this is true whether you're a family caregiver or a healthcare professional. So what do we see all the time in the news? And these have been two very recent comments that I've seen in the paper, and I love waking up to this in the morning when I'm listening to the news while I'm getting ready for work after I've had poor night's sleep. And this is one that came up recently that said lack of sleep can raise Alzheimer's disease risk. Very current topic, and we'll be talking a little bit about this when we get to Alzheimer's. Another comment in the news, and this one happened to be in a weekly archive for physicians, but this was on the news, that lack of sleep increases the risk of falls. And there is absolute evidence to support this, but I'm going to talk to you about some of the other reasons that I think might be causing this as well after we go through a number of slides and a little bit more of the program. So sleep is always on everybody's mind, and let me just say, in addition, I was telling the staff that I just got my Real Simple magazine. I'm always about a month behind reading. But one of the entire articles in there was on sleep. So I think this is a very current topic and something that's important for all of us to look at. So let's talk just for a very short minute about the physiologic changes in sleep that accompany aging. And we do know that there are changes in circadian rhythm. And I often wonder, I hear that word a lot, and I wonder how many people even know what circadian rhythm is. But in Latin, it means around a day. Or how is your rhythm? What is the rhythm of your life, your sleep patterns and your wake patterns? So that's all that circadian is. Older adults are known to demonstrate a sleepiness about 2 or 6 p.m. And that may be one of the reasons that older people go to bed so much earlier. I know when my daughter comes home from school, she asks if we'll still be awake for dinner at 6 because she knows that I'd like to go to bed around 5 p.m. This is a part of a very interesting concept that we'll get into just a little bit, but I do want you to know that older adults may demonstrate that need, but also some of this may be just because when we're older we have time to nap at those times. We'll talk about that. It is normal for aging adults to have an increase in time until sleep onset. What does that mean? It just means they stay awake longer when they lay down in bed. And we're going to see there's about 5 reasons why that happens, but that is a normal physiologic change in sleep that accompanies aging. And it is normal to require as much sleep as younger individuals, but they divide up elders' sleep between nighttime slumber and daytime naps. And like I said, when I'm at work during the day, I'm not allowed to take a daytime nap. But if I'm retired, it's really easy for me to sit in that chair and fall asleep or to go lay down on the bed and take a little nap. And it's according to how much napping and how often we're doing this that may have the greatest effect on our sleep patterns. So, common causes for difficulty sleeping for seniors. These are the ones that are listed no matter what you read. I think that some of these may affect aging more, but I'm going to tell you I think it's probably true for all of us. One of the things is stress, and we think about, I have stress all day long with a job, I have stress with a child in college, you have stress with a child maybe in day school, all the issues that you're dealing with. But in elders, some of the things we don't think about, what is stressing them, is many times financial stress or worrying about their children. And I want you to think about this. Many people who are 90 years of age that are suffering stress worrying about their children may have a 70-year-old child, just a 20-year age span. And yes, their 70-year-old may be having more health issues than they are. We just don't think about all the stressors that come that are still there with aging. Depression. This goes on, and this is throughout life. We see depression in young people and older adults. What we need to think about in depression is it clinical depression? But one of the most common causes for depression, and it may be a reason for sleeplessness, is isolation. That they're not having enough activity, not enough motivation in their life, not feeling like they're needed. And it's very important if we work in a healthcare environment to understand how important activities are, how important religious services are to help prevent this depression. If you're a family caregiver, it's no different for the person that you're caring for at home. They still need to feel needed, and they need to have a lot of activity going on in their life. So this is one thing that we can look at with aging. Anxiety, we're going to talk about restless leg syndrome in a minute, but anxiety comes from being afraid of being alone, fear of being sick, fear of dying. There's so many issues that go on, but they're very common causes and things that keep people awake at night. Recent loss or trauma in elders is most likely due to the loss of a spouse, and we see some tremendously disrupted sleep patterns in seniors after the loss of a spouse. We also know, as we just said, that if you're a 90-year-old parent and you lose a 70-year-old child, that is a loss and a trauma that is no more diminished because of age. So these are very common issues that are happening. Medications that keep folks awake, we'll talk a lot about medications, but I think the most important thing that I can tell you is every med that you're taking, you need to know why, what is the best time of day to take that medication, and to know that every medication that you add on to your list of meds is a chance for an interaction that can cause sleeplessness. So I'll tell you that our next eye care series will have Carrie Allen, who is a pharmacist who deals in geriatrics, and she's going to talk a little bit about this with over-the-counter medications as well. And then we'll get into some health problems, and those are very clear, and we'll talk about that in just a second. Bet you didn't know, though, that the #1 most common reason for poor sleep in seniors is their environment. And this makes me laugh because I'm always honest with you all. I'm 61 years old, so I'm now a senior. I'm a dual member of AARP with my husband. And when I looked at this picture that was put together for me for this presentation, I almost died. Because I want you to know that I go to bed every night with not one dog on the bed, but 2. We go to bed with a TV screen. I don't know how many inches it is, but it looks like the Spurs players could jump in the bed with us. It's that close, and it's that bright and that big. The temperature in the room for the environment is imperative that you look at. We have a change in our core body temperature as we age up, and it does affect sleep. And then we talk about screens like what are you doing before you go to sleep. So if you're on the computer, I do that every night before I go to bed. I'm checking the last of my emails for the day and getting ready for the next day and looking at my calendar, watching TV, probably too hot in the room. I'll tell you that story in a second. Watching the TV, and then the dogs. So as we go through this, you're going to hear more and more about environment because it's so important to create the right environment for sleep. Now that's when you're at home, because most of us don't have dogs in our bed at the nursing home or in assisted living. But if you work in a hospital or a nursing home and you're a caregiver there, I want you to think about the noises that go on during normal sleep times. The telephones don't stop. The call lights don't stop all night long. When do we do the floor repair and the buffing? We do all of that during the nighttime hours, which creates noise. We have lights on. I want you to know this is when the laundry carts are being rolled up. The dirty dishes are being taken away. I hope that if you are a family member or you are a caregiver in a facility, that you will stop and listen for those noises and see what can we do to reduce some of that during the nighttime hours. I love to tell people that as a nurse, and having been one for years, everybody wants to say that folks who work on 11 to 7 have the easiest of jobs because everybody's asleep. My rounds, and especially when I do quality assurance rounds, have always shown me more than half of the residents are up at night. They're on their call lights calling for pain meds. They can't sleep. They're uncomfortable. They're anxious. They're walking around. I have never been a believer that the night shift is the easiest shift. I think it's one of the most difficult shifts when you think about staffing. So let's be very cognizant of that. So let's look at some causes for sleep problems that we might not have considered. So we've gone through a list that we're going to go back to, but this was one that I felt like we couldn't have this presentation and not go over. And that is restless leg syndrome. You know, most of us haven't heard about restless leg syndrome until we saw it on TV commercials for medications. And people talking about this. This was not a common thing when I was going through nursing school, or even in the last few years, until I started watching TV at night, mostly when I can't sleep, is the restless leg syndrome. First of all, I want to tell you, I wasn't even sure if this was real. What was this, or was this something just to get a medication? I want to tell you for sure it is very real. And it is a neurological disorder. And the people who studied this believe that it's caused by an imbalance in dopamine. And if you think about that, and I promised you I wasn't going to get into the chemistry of the brain, very similar, though, to some issues that happen with movement in Parkinsonian when we think about dopamine. There is a genetic predisposition to restless leg syndrome, and it is more common in women than it is in men. But most amazing to me is that 1 out of 10 people have it. And it's very often misdiagnosed as just a nervous disorder, but really it's something completely different. This program is not about Maria Wellisch, but I want to tell you personally, I had never suffered from restless leg syndrome until recently, and it is the most uncomfortable thing and so hard to explain. When people say what restless leg syndrome is to them, this is some of the words that they use. It's a creepy feeling. It makes you want to just keep moving your legs and moving your legs. Yesterday, one of my coworkers came in and I said, "Do you have restless leg syndrome?" And she said, "No, I don't even know what it is." And somebody else who walked in the room said, "I have it." And I said, "Tell me what it's like." And she said, "Oh, it's this creepy, creepy feeling. And it's like I can't stop moving my legs." It was like it was the perfect definition of this. It is known to be worse when you're resting. And that doesn't mean just when you go to bed. It can be when you sit in a recliner or you just stop for the day. And it makes you want to get up and it makes you want to move. So it does happen more at night when people first lay down to go to sleep. But more than anything else, I want to tell you, if 1 in 10 people have this and they don't talk to their doctor about it, this may be one major thing that we can do to affect sleep in seniors. And think if somebody has cognition issues, they can't even explain to us that they're going through this. So if you see them moving their legs and moving their legs and patting at them, my mother used to do this when she had dementia. She would say, my legs, but we didn't know what was going on. I'm sure she had restless leg syndrome, and now that I know there's a genetic predisposition, I'm even more convinced. Is there anything that we can do for restless leg syndrome? Well, there is, and I'm going to go over the first things that we can do for any sleepness that we're having, and that is set a sleep schedule. Go to bed at the same time and get up at the same time. And we're going to talk about the times of the day to exercise and what kind of exercise, but exercise is good for restless leg syndrome. Decreasing caffeine. Saying no to cigarettes and alcohol. There are some vitamin supplements that they found to be very effective in the treatment of restless leg syndrome. So people who have this should have a blood workup and especially have their iron looked at. Losing weight yoga, and meditation. Some non-drug interventions other than the vitamin supplements that might help with restless leg syndrome. Interesting that there are actual exercises for calf, thigh, and hip stretches that seem to help people. And the young woman who came in to say, yes, I have it, I said, what do you do for it? And she said, I do stretching. So we do know what those exercises are, and if any of you have a question about that and are suffering from restless leg, you can always send me an email at info@mmlearn.org, and I'll be delighted to share with you what I've been able to find out. One of the best things to do is just get up and walk around for a few minutes, and the one thing I found that has helped me the most is to take a shower. Even if I've just taken one, if I go back in and take another one, it seems to relieve that. So these are some good ideas to try. You can try some over-the-counter pain relievers like Advil or Tylenol, but you want to be very careful with that, and again, talk with your physician before you do that. Hot or cold compresses to the legs have helped some people. Haven't heard that's quite as effective as some of the other interventions. And then there are physician-prescribed medications that can be given. The most common of these are the Maripex and Requip, and the reason being that these are the drugs that are actually used for treatment in Parkinsonian disorder. But they have been approved by the FDA for restless leg syndrome. And they used to be off-label use, meaning people learned that this helped and they waited for testing and then found it was approved. So many physicians will prescribe these medications for restless leg, and it's helpful to know that there is something there that we can try. But with restless leg syndrome being as common as it is, as underlooked at for our folks that are restless when they're sleeping, I want you also to know there's some things that you need to be really careful about. And one of them is narcotic painkillers. And we know that's true for anybody, but just think about this. If this is one of the things that we're giving to people, a narcotic, to make them more comfortable, and we're saying that people who get less sleep fall more, they may be falling because of the medications they're taking as well. Hard to differentiate that. They can provide relief, but remember, they can be addictive. And if you're not worried about that, think about the other side effects that include nausea, dizziness, and constipation. The dizziness means the falls. The nausea, these side effects can be just terrible from narcotics. So be careful before you begin taking these right away. Sleep medications and muscle relaxants can help you sleep better, but they also cause the daytime drowsiness, and this can become the vicious circle, just vicious, of you go to sleep during the day, you can't sleep at night. You're taking the medication so that you can relax, and then you're sleeping all day. So you have to, this is a give and take, and it does take some learning. We have also found that anti-seizure meds, the Neurontin and Tegretol, can be used effectively for daytime symptoms. But dizziness and drowsiness, again, may occur. And so with every treatment, we know that there is always some side effects or concerns. Gosh, when we listen to commercials on TV, I wouldn't take anything. I'd be afraid of being deaf, dumb, and blind for, my sexuality. The next thing is medications that can make restless leg syndrome even worse. We don't think about that. We're taking something that we think is going to help us, and then we just think that the problem's getting worse, where in truth it may be the medication that's making the problem worse. So let's think about this. Over-the-counter sleeping pills. I don't like to get into brand names, but it's things like melatonin that is over-the-counter. Melatonin, people don't even think of that as a medication. They think of that, of course, as an herb. Too much melatonin can increase this problem. You have to be very careful, and I hope when Carrie Allen is here next month, you'll ask about these things because she is so knowledgeable. Antihistamines are found in cold and allergy pills, and those are things like Benadryl, NyQuil, and Dimetapp. But I want to talk to you about the drug Benadryl. Benadryl, for those nurses of us and physicians know, this is diphenhydramine hydrochloride. We all learned that when we were back in our early years of practice, and it was like the miracle drug. For me, Benadryl was the miracle drug when I did transatlantic flights when I lived in Europe with my children. Yes, I'm a bad mother. I would give my children a little Benadryl, a little Dimetapp, so they'd sleep as we crossed the ocean. Just one dose because they had a little sniffle. Truth is, I would give Benadryl to one child and she would sleep wonderfully, and give it to the other child and she'd be pinging off the walls. We all have different reactions to medications. Benadryl happens to be a drug that is on the Beers list, and that is drugs that should be used with caution when we deal with elders. How many of you know that when you take Tylenol PM or Advil PM, that the PM actually stands for Benadryl? Yes, that is the drug that makes it a nighttime pain reliever that's going to help you to sleep. So if you have a senior and you're giving them Advil PM, you've already given them a drug that we know is not good to use and is contraindicated in seniors. Other things I want to mention about making RLS work or your sleep worse or your sleep time worse is things like NyQuil. It's just like taking alcohol. It has a high amount of that. If you've ever taken NyQuil, you'll know that you take a good swig of that, you go to sleep, you feel like, man, I'm getting a great night's sleep, and then you wake up and you're startled awake and you can't get back to sleep. It's just like alcohol. It's when it wears off, it helps you to get to sleep, but it makes you wake up and you're not going back to sleep, and then it's up for the rest of the night. Anti-nausea meds can also make RLS work and sleep worse. That's your Antivert, Compazine, and even Dramamine. And these are some things that you can buy over the counter. Antidepressants, Prozac, Effexor, Lexapro. Want to talk with your doctor if you're having restless leg syndrome, as well as antipsychotics. And those are drugs that we use for bipolar disorder and schizophrenia. So just be aware of this and use all of this when you meet with your physician. So enough for restless leg syndrome. I'll be glad to answer any questions about that. But let's move on to another thing that we know, a condition that we seem to see more of as we age up, and that's obstructive sleep apnea, or OSA. And what is it? Well, this is the condition, and our definition says, in which intermittent pharyngeal obstruction causes cessation of respiratory airflow and often oxygen desaturation. That sounds like a lot of big stuff. What it means is that you have an interruption in the amount of airflow, and I have to tell you, if you're not getting enough oxygenation, you wake yourself up, and it's called sleep apnea without oxygen. Short periods. What does it look like? It's accompanied by snoring, gasping, daytime sleepiness, and impaired daytime functioning. Obstructive sleep apnea. We hear about this all the time, you know, that people have. I have apnea. I have sleep apnea. I have to tell you that I am convinced that my husband has OSA. When I think about the snoring and the gasping, this isn't just a little, I mean, this is the, and then all of a sudden there's no noise, or the strange noises that you're hearing, that gasping, they kind of wake themselves up with a startle and then right back into that same mode. It's driving me crazy. It may be one reason I'm not sleeping and should move to the other bed, but I'm not ready for that. And we'll talk about other things in a minute. But this condition is age-related, and we do know that there are some things we can do to help with it. So what should we look for with this sleep apnea or this obstructive disorder? We see this commonly in people who are age 60 to 70. They're overweight or may even be obese. They may have decreased lung capacity, decreased muscular endurance, and of course altered sleep. So those are some things to look for if you're thinking about maybe you should go see the doctor regarding sleep apnea. I could do more of the snoring for you because I have that down pat. What's the treatment for this? Well, the treatment is based on the pathology, or what is wrong and what's causing it. And in some cases, surgical intervention works very well, and I know this has been very successful for some people. There are oral appliances that somebody can go to sleep that are fitted and made to put in the mouth. Weight loss may be the only thing that you have to do to stop this problem. So that's something to consider, and go back to your exercise, and we'll talk about good diet. And then there's the CPAP machine, or the continuous positive airway pressure. And I hope you can see this picture, and for those of you that have joined us on the phone, it is a little machine that goes next to the bed, and it has a nasal piece that is strapped on. Younger people seem to have more trouble wearing this apparatus. Seniors seem to do better with it. I've thought about this a lot and wondered why. I have to tell you one thing is I don't know that I would have dated my husband if I knew that's what he wore at night, but today I'd be more reasonable with that. But we do have to look at CPAP as a very positive thing, and again, you need to see a physician, and there are many, many sleep clinics and sleep disorder specialists. We talked in the very beginning about pain and medical illnesses that interrupt sleep. We know that any time you have pain, that interrupts your sleep patterns, and one of the most common in seniors is arthritis. There is also the frequent need to urinate, and that is something that you need to tell your physician about. The arthritis you don't usually tend to miss. You'll tell the doctor you're having pain in your fingers or your knees, your joints. But many people forget to tell their doctor about frequent need to urinate during the evening, and getting up and getting down to go to the bathroom is definitely something that interferes. Asthma. If you're having trouble breathing, of course you're not going to sleep well. Heartburn can be a reflux disorder, and something for sure, if you have heartburn, that you should tell the physician about. And sometimes this is as simple a fix as just raising the level of the bed. I remember we used to tell people to put up the bed on bricks just to get so that you wouldn't have acid reflux happening. Some things that help with that are not eating late-time meals, not taking caffeine, and not eating spicy food. So eating earlier in the evening may reduce that heartburn. Menopause, I promised you this wasn't a lecture about Maria, but it's becoming one. I will tell you that I think that's part of sleeping. Women who have hot flashes during the night, suffered from these for a number of years. It's miserable, and it does disrupt sleep. And then, of course, the issue of Alzheimer's disease. Big problem when it comes to sleep, not only for the care receiver, the person with Alzheimer's, but for the caregiver. 24%, just think about this, 24% of Alzheimer's patients wake up caregivers at night. That's huge. That means a quarter of the people taking care of someone with Alzheimer's disease is being woken at night by their care receiver, by the person that they love and they're caring for. Statistically, 70% of people with Alzheimer's have sleep disorders themselves. They may not be waking up the caregiver. They may be in a facility, but that means they are awake. 70% of Alzheimer patients do suffer at some time during this disease with sleep disorder, and sometimes all the way throughout. I want you to come away from this presentation knowing that both you and your care receiver deserve and need sleep. Without it, I have to tell you, is agitation. Whether or not you're taking care of someone, if you're not sleeping enough, you get agitated. You get cranky. You lose patience. You don't feel well. You don't concentrate well. Those are all side effects, and you can't be a good caregiver if you're not getting enough sleep. So what to do? Everything that you would do for the person who has Alzheimer's is what you should be doing for yourself. It's what all of us should be doing for ourselves to affect sleep. One of the things about exercise is there are lots of types of exercise, and nobody is going to diminish the importance or value of Tai Chi, of meditation type of exercises. But I want you to know when we're talking about exercise as it relates to sleep, we're talking about aerobic exercise. Now that doesn't mean running the Boston Marathon. It just means that you need to get the heart rate up. And so that can be walking and that can be swimming. But the worst thing that you can do is do the exercise when it's cooler late in the evening, say around 6 o'clock, and somebody's bedtime is 8. They say it should not be done any less than 3 hours before bedtime. So you don't want, if you go to bed at 7, 4 o'clock would be the very last time that you should be doing the exercise. But I will tell you that there are other studies that will tell you that you will have far better effect if you will do it in the morning. And I think this makes good sense because they also say that if you exercise in the morning, it has more to do with your endorphins and your mood. So if you can change the depression and the mood, it may have more value. Other studies will tell you that it shouldn't be done 6 hours, no sooner than 6 hours before bedtime or later. So think about those hours, but just don't do those nighttime walks to get somebody tired out right before bed because it's going to be a stimulant instead. Unquestionably, seniors take more meds than younger people do. And I think even as a nurse, we sometimes miss the fact that if we have somebody who's not sleeping at night, we fail to ask the pharmacy consultant to look at the medications of this resident. Because many meds have a side effect of giving you more energy or making you more wakeful. Those are the meds we want to give in the morning. If the doctor says take once a day, we want to take the meds that keep you up early in the morning and the meds that are going to make you sleepier closer to the evening. I can't keep up with all the meds. When I think of all the meds I look at, I just did a chart review last Sunday. I couldn't believe the number of meds and how many I had to look up myself to even know what they were for. We can't be expected to know all this. Ask your pharmacist, ask the nurse, ask the doctor who's prescribing it, and then go online and look things up. But you know there's a million side effects, but sometimes we have to juggle when we use them. You shouldn't be doing this. You should be asking your physician to help you to do that. All right, we're talking a little bit about Alzheimer's right now, and we're talking about anxiety and depression. Well, if I had a loved one that had Alzheimer's, that does create anxiety at sleep time. And you know why often? Because the person isn't sleeping. They're up walking around. We said that 24% of these people are getting their caregiver up. That would make me anxious. And do you get depressed? You get depressed because you're not getting enough sleep. And the person who's not sleeping may have depression because they're not getting enough exercise or enough motivation. We talked about that. So what do we do about it? You can't listen to people when they say, well, when your loved one takes a nap, that's when you should take a nap. People used to tell me that when I had young children. When the kids go down for a nap when they're up all night, that's when you should take a nap. Well, what I wanted to know was when was I supposed to wash the clothes, cook the dinner? Not that I cooked a lot, but I want you to know we had a lot of cold dinners. But when are you supposed to do the normal housework? When do you do your life and pay the bills? But when the child is sleeping. So the idea of just taking a nap, that's easy said, and if you can do it, gosh, I encourage you to. But if you can't, there are some tools and thoughts. Always check the Alzheimer's Association. They have great tips. But I want to tell you, baby monitors are an answer. I mean, these are an answer to a prayer to have in your bedroom and to put out in several places in the home so that you can hear, if you're a light enough sleeper, to hear your family member. If the person is somebody who's going to go for the stove, there are caps that you can put on this. There are things to make it that somebody can't even turn on the water. If you go to Home Depot, you go to Toys R Us or Babies R Us, I hate to use those stores and talk about this, but I want you to know all the mechanisms are there and available for you to help you so you can get some sleep. Yes, you have to lock up the Clorox. Yes, you have to lock up the chemicals. I am not equating your loved one to a child, but it is no different than creating a safe environment. You have to remember it's going to be at a different level. Everything was down low, as somebody mentioned to me. When you have children now, you have to think about everything being up high as well. You need to have an alarm system on your door so they aren't going to walk out at night and be lost. But there are things that you can do to try to get a more restful night's sleep, because even if your loved one is up, if the house is safe and they haven't reached a point that you don't have to have someone else with you or they don't have to be in care, there are products that can help you. Again, we're always willing to answer questions. Write to us at info@mmlearn or call us. But also use those resources from the Alzheimer's Association. They're wonderful for these kind of thoughts. In the very beginning, we talked about a sleep-friendly room. And it should be a quiet room. It should be a dark room. And that doesn't mean a small nightlight. It just doesn't mean the 48-inch color TV in front of the bed. The room should be cool and comfortable. You want comfortable bed linens and comfortable pillows. Some people are really turned off with soft sheets. Find out what makes somebody comfortable. If it's your loved one, if it's for yourself, invest in that for you. It is well worth it. Turn off the TV. And if my husband ever watched this program, I'd like to repeat, turn off the TV. You need to move the bedroom clocks out of view. This is really interesting, and if you want to go online and look at some of the shows by Dr. Oz, he did some incredible things on sleep. And this was one that he talked about and one that I've done a tremendous amount of reading, but clocks in the room should be turned around or should be covered. The light is disrupted, it changes, it kind of flickers. The other thing is, if you keep looking at the clock, it tends to make sleeping even more difficult. This is me. It's 12:36. Oh my gosh, I got to get some sleep. It's 1:13. Oh my gosh, I'm never going to go to sleep. It's now 1:35. Shoot, at 2 o'clock, I wonder if I ought to just get up. I've only got 3 more hours. That clock is driving you crazy. Get the clock out of your room. Put the alarm somewhere where you don't see it. Set your phone with an alarm, something like that. So we're into daytime habits. And some of the daytime habits that we talked about already were exercise. But I'm going to show you a little bit farther down. It says sunlight. So if you can exercise in the morning and get 2 hours of sunlight per day to increase your melatonin, I will tell you that we've seen tremendous effects on how that helps people. I think about people who are in an office all day long, or people who work in a hospital and assisted living. We hardly ever get the residents outside. We hardly ever get them fresh sunshine and fresh air, and it doesn't have to be in the beating sun where we are in Texas. It can be at a great time in the morning, and it can be very pleasant. So we need to increase the amount of sunlight, and we can do it with our exercise. Please, please, please understand how important socialization is to improve your mood. And then limiting caffeine, alcohol, and nicotine. No question, these are going to help you. Make sure that you put on sunscreen. Please make sure that you're wearing sunglasses unless they're going to obstruct vision for you and make it more difficult for the person who has Alzheimer's. Regularity cannot be stressed enough. You need to go to bed and get up at the same time every day, and they say that's even true for weekends. You don't make up sleep. If you have sleep debt, that means that you missed an hour every night. You went to bed an hour later this week or 4 hours later and didn't get to bed till midnight and your bedtime is 8. Didn't get to bed till 1 a.m. Your bedtime is 9 or 10. You don't get to make up that sleep on a weekend. If you do sleep with somebody who snores, you can get little ear things to shut out some of that sound, and it doesn't impede your sleeping and turning your head. Go to bed earlier if your body's telling you to do it and your body is changing. If your sleep cycle, your circadian rhythm is changing, let your body tell you a little bit about what to do, but don't stay in bed longer in the morning. How much sleep does somebody need when they're an elder? Well, anywhere between 8 to 9 hours is what is recommended, the same as it is for a teenager. The other thing is, do try to limit sleeping pills. And that doesn't mean that you won't have to take them at all. Sleeping pills can be a great aid, but we try to stop taking them as soon as you have gotten back into a sleep pattern. Sleeping pills can just make this all the more difficult, and this again can just become a routine problem. And I know that everybody thinks when we talk about elders that we don't have to talk about sex, but I want you to know that sex, combining sex and sleep, intimacy helps. And I want you to know that it doesn't have to mean actual sexual activity. For many people, this is just holding hands. This is just patting someone's back. This is just hugging someone. But I can tell you that intimacy, we know, affects sleep as well. The need to be loved doesn't change with age. Should you nap? Yes, you should nap. And we know that people with Alzheimer's do a lot of napping. But I want you to know that you should keep them short, and they shouldn't be late in the day. And remember, at the very beginning of this presentation, I told you that our sleep times as we get older, we tend to get sleepier around 2 o'clock and 6 o'clock p.m. 6 o'clock p.m. is not the time to take the nap if that isn't the bedtime for the person. So napping is important. When I think about baby sleep, anywhere from 13 to 16 hours a day, I want you to know that we cannot diminish because we're older. As I wrap up this program, I just want you to know sleep is not just something that young people need to grow. We all need sleep for our health, our well-being. So very, very important to us. So we have about 15 minutes left, and I do see that I have some questions here, and so I'm going to run those for you. And thanks for sending them in. And if you have some more while we have this time, you can go ahead and click on that bubble, or you can text those in. So I have a question from Peggy. Peggy, thank you for sending this in. The question is there a limit to the number of caffeine drinks one should have? They do say to limit caffeine, but one of the studies that I just read said that up to 2 8-ounce cups of caffeine should not hurt you, and you can go ahead and, but they do tell you that after lunch the caffeine should be cut off. So that's a long time. So when you think about people having tea or coffee with dinner, that's too late. And remember how many things actually have caffeine in it. People think when they drink tea, they're not getting caffeine. When they drink Coca-Colas, they don't think about caffeine. So they talk about that 2 8-ounce in a day and no more after lunchtime. This is from Marie. What if someone with dementia cannot communicate their RLS symptoms? Is there an actual test for this? Interesting that the first thing that you want to do is mention this to your physician. And the reason that you want to mention this to your physician is because the blood test may tell you some biological reason for that RLS that they can treat. And that might be a B12 deficiency, an iron deficiency, something that is relatively treated. The most important thing, and if I can go back to that question for 1 second maybe, is that if they can't communicate it, what you have to do is tell the doctor what you're seeing that makes you think that it's RLS. And I will tell you that constant leg movement, that twitching, somebody rubbing their legs, feeling they look like they're agitated, but those legs are moving. I think that's a great question, but make sure that you tell the physician. Those are real symptoms. From Jennifer, are there any foods that can help you sleep? Great question. Yes, there are foods that can help you sleep. The foods that have tryptophan in it are foods that you want to look at. But very interesting about certain foods that you need to combine foods. And one of the things is with tryptophan, you want to have carbohydrates. Too much protein, I've read studies, may interfere with sleep. And you know this stuff changes every day. Today you can have coffee, tomorrow you can't. Today you can have red wine, tomorrow you can't. It all goes on and on. But I will tell you that I think it's really interesting when you think about the higher carbohydrate meals. A lot of talk about drinking milk before bed. But remember, if someone's getting up to urinate throughout the entire night, you want to begin to restrict some of those fluids, and unless there's some contraindication to that. Usually there's not. Susan, how can I get a copy of the Beers list? Yeah, and that's I can't stress this list enough. On that little paper clip at the top, you can click on that and download and print the Beers list. You can just Google the Beers list, and you'll come up with that. I want to tell you that just recently I gave a class to a group of graduating RNs, young GNs, graduating nurses, getting ready to take their boards. And when I asked how many in the room had heard of the Beers list, not one person raised their hand. That is really important, folks. If we work with seniors, we need to know what we're putting in our own bodies, what we're giving to those people that we're caring for. So the Beers list it's not 100% that you can never give it, but you should understand why the drugs on that are contraindicated in elderly. So thanks for asking the question again. And then from an anonymous person, you never have to keep your name from me. You can always tell me who you are. Do sleep problems get worse as Alzheimer's progresses? That's a good question, too. We know that sleep problems can happen at any time during the disease process. We do know that as the disease progresses and later stages, people will sleep more and more and more because of what's happening to the brain. In the early stages, we see the sleep disorders more in relation to what I would call sundowning type of thing. And as we study Alzheimer's, and that's another whole class, but the circadian rhythms, that day and sleep cycles are getting mixed up for those folks. And so we do see it throughout. I'm not going to say it gets worse. I just think people sleep more is what I've seen with the disease and has been attested to. So I don't have any other questions here. So, but I did want to, thought if I had a few minutes and a little bit of extra time, and I do, I would share with you some very common misconceptions about sleep. And sleep time, this is misconception number one. Sleep is time for the body in general and the brain specifically to shut down for rest. And not true. I want you to know that sleep is a very active process of the brain that's causing repair. It is doing so many things for you. So it's not a time that the brain is going dead. It is a very busy time during sleep. And that's one of the reasons we need so much of it, and it's so important to our well-being. Misconception 2, getting just 1 hour less sleep per night than needed will not have any effect on daytime functioning. Not true. Even a modest reduction in sleep by even an hour has shown a change in people's ability to answer questions and comprehension. 1 hour difference. They've also shown tests where people, if they take a nap, very short nap, will awake and will get up and have better comprehension and retention. So before you take your test, take a little nap, but not a long one, because they find that that disrupts it more. Misconception 3, that the body adjusts quickly to different sleep schedules. Wow. This is interesting for healthcare workers, especially who switch from shift to shift, 7 to 3, 3 to 11, 11 to 7, pick up a double, I'll work 11 to 7. No, it's not a quick time frame to readjust back. As a matter of fact, they equate this to jet lag, and they say it takes 2 to 3 days if you've had one disruption in that sleep pattern to get back into your normal rhythm. That's a great one. People need less sleep as they grow older. No, we already answered that one. Older people don't need less sleep, but they often get less sleep, and I hope we've covered a lot of reasons why on that one. And I would say to you that excessive daytime sleepiness is associated with a sleep disorder or other medical conditions, and that can be true. That's not really a misconception. Sleep disorders, including sleep apnea, the absence of breathing, remember, during sleep, may be a real sign of a disorder that you need to look at. So this has been one of the most interesting studies that I've had. I really want to encourage people, if you have an interest and would like more information and are dealing with people with Parkinsonian disorder, that I have done so much study on this as well that I'd love to do a presentation or bring in someone to do it, because Parkinsonian disorder and sleep disorders, that disease with sleep, are a lot of issues we really need to think about for everyone. So I don't have any other questions. We've had a great time together. It's a beautiful day. I want to go home and take a nap. If I put you to sleep, good for you. Wake up, and hopefully you feel refreshed and a